Hey friends, Jessica here from Northern California, and if you are new to my channel, I am here documenting my breast cancer journey. I was diagnosed with stage 3B breast cancer in October of 2022. I had a radical mastectomy of the left side. I went through chemotherapy, radiation therapy, and I've had a slew of other surgeries since then. Today, I want to talk about the importance of the journey that we are going through. And at any given point in time, we have no clue what someone else may be going through. I am a dental hygienist by trade, and yesterday I had a patient on my schedule who, when I clicked into their chart, it showed that she is going through treatments with Kaiser, so same provider that I have, as far as like where I get all of my care done. I looked through and all that I saw in there was that she was taking the Zometa infusion, which to my knowledge, that is for, obviously for us going through breast cancer, it is after chemotherapy. The chemo can deplete the bones. And so they give us Zometa infusion to help reinforce and strengthen our bones back up. But I also noted on there that she saw the same oncologist that I have, which the oncologist team or oncology team at Kaiser, they see patients for multiple reasons. But on her medical clearance, I didn't see what type of cancer she had, and like what was going on. So she sat in my chair and I kind of asked her, I was like, okay, so I see you have this medical clearance. You couldn't come in until 4 months after the infusion you just had. What's going on? And she told me that she had breast cancer. In 2020, during COVID, she was diagnosed. She had a mastectomy of one side, went through chemo, had the zoledronic acid, had the same, I'm going to totally butcher the word, nevilestine shots that I had to do after the AC or Red Devil portion of chemotherapy. Went through radiation, so almost like mimicked exactly everything I had gone through. But she had only had a single mastectomy. She healed up from that after radiation, decided to move forward with an implant to make herself look even again, which is amazing. Due to the type of ethnicity she is. Certain ethnicities, after they have surgery of any type, they can keloid, which is like bumps under the skin. So she had keloided right up to the midline or center where the scar was, almost onto the opposite side where she still had a natural breast remaining. So 2 years after she went through all of the treatment on one side, she noticed one of the keloids just did not feel like the other ones did. And so she went to Kaiser, had an ultrasound done, had a biopsy done, and unfortunately the cancer had come back on now the opposite side. So her treatment of choice, rather than going through a mastectomy of the opposite side and having surgery again, is she went ahead and had a lumpectomy, had to go through some chemo again, tiny bit of radiation. But thank God now we are in 2026 and she is clear. She still goes through scans. She still goes through the Zometa infusions. She feels good. I asked her, we kind of compared stories of how we feel after having Zometa, how we feel now versus how we felt prior to cancer. And a lot of our stories lined up. She's tired. She doesn't have the energy that she used to. She is a nurse by trade and she used to be able to work doubles. Now she can kind of work one, regular shift and she's kind of done. She, I want to say, was like 64. I'm 38. So it's amazing that no matter what age we are, what we're going through in this journey, that it can it really affects us all in the same way. So just watch your body. If something doesn't feel right, especially after having a lumpectomy, call your doctor, call your surgeon, have them get you in for an ultrasound. I'm very aware of my body. I found the cancer myself. And so I still check everything I have my husband feel my back, which, I mean, not likely to get it back there, but I have a scar 360 around my body. So I'm very aware to make sure that I'm feeling, if something feels wrong, I email my doctor. I am currently waiting to see my oncologist because I have some swelling in my left arm. And so I'm waiting to get in to see her. Unfortunately, with my kids on spring break, the schedules just didn't align up for me to see her this week. So I think like in a week and a half or two, I go see her. One other thing, and I know that I've said this so many times, but if you're going to go through chemo and you're going to start this journey, really advocate or ask. And if they say no, ask why not. Get a chemo port. This patient that I saw yesterday did not have a chemo port, and she believes it was because it was during COVID, and so a lot of things were shut down, a lot of things weren't prioritized like they are now, but her veins are so exhausted from being poked over and over between chemotherapy, the Zometa infusions, surgeries that she's had. Like, her veins are tired. I have my port right here. It's an easy 1, 2, 3, breathe in, they poke it in, and it's done. They're not having to go into veins and damage the insides of our veins over and over, because the veins can get scar tissue in them, and it just makes it more uncomfortable moving forward with everything every test that we have to go through. They pretty much need vein access, or they can use your port. So all over the place. I just want you guys to know that we're truly not in this alone. There are so many people day in, day out going through the exact same things that we are. And we should all just be here to support each other. When I left her yesterday, we had a big hug. The front office was kind of like, what is going on? My first time meeting this patient. They're like, why is she so excited? And it's like, we're soul sisters because we've been through this together. So guys, take it easy. I hope you're all doing well. I'm sorry this was kind of a long video in the dark. I'm getting here for Pilates while the kids are on spring break, so it's dark. I will be sure to check in soon. And if you find this video helpful, I hate asking for this, but if you can like and share and subscribe, that way we can get the word out to more people, for like real life people like me on here posting, because there's not a lot of that. A lot of it is doctors or people giving their opinions about things. It's not real world, real life like we're going through. So I'll check in soon. Bye.